Hey everyone, this is your Utah chiropractor, Dr. Sunny Tuft. I'm here today with Coeur d'Alene. She's been a long time patient. We've done a lot of muscle activation on her, got those working, and now she's more of a maintenance patient.
Yeah.
Probably about 3 weeks ago or so, she happened to be in for a visit. Maybe it was 4 weeks ago. And as I walked out of the room and went in to work with another patient, she happened to see that we had the ring gear table. And from what I heard from our front desk staff, she got extremely excited and it was just really funny. So that was the talk of the staff that day about how excited she was. What made you so excited?
I've actually been watching the Ring Dinger on YouTube for probably the past 3 years, and I just felt like I had to travel to Texas in order to get it done. So then once I saw you have it, I was like, telling everyone, and yeah, I just couldn't wait to get in.
It was funny. She's pretty cute. That when she came in today, she said she's just nervous. She's gonna cry from all the excitement that she has. But
I'm already doing.
so Coeur d'Alene, she does a lot of hair, so she has a lot of tightness up in her neck and her upper back, and also in her low back. We've taken care of a lot of the major pain and kind of keep her. She, like I said, she's more of a maintenance one. But she wanted to experience the ring gear, so this is going to be her first ring gear treatment today. So you ready to get started?
I'm so excited.
Good. Let's have you lay on your stomach.
Okay.
Perfect. All right, so we come down. Looking at her legs, you're a little bit short on your right leg. It's a little bit. As I bring this up, does that tighten up in your low back?
Yeah.
Yeah, okay. Let's test. I want you to keep your knee straight, lift this leg up as high as you can. Okay, good. Down, left side. Give me a comparison. Tell me if one's easier or if there's any pain.
This one's definitely harder.
Yeah, you went higher on your left side, probably about 3-4 inches there. So what we're seeing is Coeur d'Alene's hips are twisted and torqued this way. This rocks back and high, makes that look short. This one rocks forward and down, makes it look long. So exaggeration, she's kind of just torqued and twisted. With the leg lifting, we're really testing the SI joint. So she's a little more stuck here on that right side. Yeah. And a little problem with the sacrum here. I'm gonna check the lumbar spine and work our way up. All right, we've got, that's a little tight and stuck there. Not bad through there. Okay, now you're starting to tighten up again up here, which makes sense with doing hair. Good. Okay, a little bit there. Perfect. Okay. Before we started the video, we also took posture. If I remember correctly, she had her right shoulder was a little high, left hip was a little high, and she had about 1.5 inches forward head posture. What that does, the muscles here come all the way down through the back and they start tightening up there. And that's common that we see with people that do hairdressers that are bent over more with their clients. Okay, so we're gonna get started. We're gonna feel this table fall. These are the SI joints, just trying to open those up a little bit. We're going to take care of the twisting of the pelvis here. Let's see if that was enough. One more should do it. Good. Doing okay?
Mm-hmm.
Perfect. There you go. Now, let's work with the sacrum a little bit. Good. All right, I want you to lift your right leg up as high as you can. Good, left side. Perfect, that was more even. Did that feel better?
Yeah.
It should, as we bend your knees. Did that loosen up the low back?
Oh yeah, definitely.
Okay, perfect. All right, now we'll just continue up the spine. So the big key with the ring dinger, with the whole treatment, with the Johnson Biophysics, is we want to get good movement in every segment of the spine. Good. L4, L3, 2, 1 more. Good. All right, deep breath in and out. Good. Good. There you go. Deep breath in and out. Let your arms fall to the ground. There you go. One more. Perfect. Okay, now it's the hardest part on this table is getting this headpiece is gonna pop up for you. You relax, because I'm gonna need to weigh, essentially it's getting the weight of your head. That's too hard. There we go. Now we're gonna come up into the neck. 3, 4. One more. Good. 5 and 6. We'll come down to 2. This adjustment right here is really going to help with that forward head posture. If we get the table set right. Good. Turn over onto your back. Remind me.
Yes.
Shoulders. Do you have one that we've normally worked on? That right one?
Well, I think the left one. That's
one?
the left one. Yeah.
Has it been bugging? Has it been feeling?
Yeah, it's been kind of bugging.
Kind of bugging? Okay, we're gonna dive a little deeper into that shoulder.
Yes.
Okay, hold right. Actually, relax here. I want you to scoot up about 2 inches. There you go, right there. Now this, I'm just gonna help to set your head back over your spine. We're gonna do 3 of these. Wonderful. Perfect. Just help open up the shoulders. Good. Ribs. Good. Relax there. Bring hands here. Now, I'm going to come back to that left shoulder. We're going to open up your knee, your hip, and part of your low back. Give a big tug right there. Good. Scoot up for me. Perfect. We're going to do this side now. Wonderful. Go and scoot back up. Let's come back and do a little more with this shoulder. I just want to check it out. Relax here. Bring this arm here. I'm going to pull here. You push down to the ground. Perfect. Bring it this way. Push up to the ceiling. Wonderful. Turn it in here. Hold here. Okay. So she weakens on that one, and that's a rotator cuff muscle. Usually we can correct that with a proper adjustment. So it's like her shoulder's jammed. I'm going to give it a tug. Good. One more. Let's see if that was enough. Turn it here. I'm going to push up and out. There you go. Palm up. Push up here. Perfect. Bend an elbow. Let it fall, let it fall. Push down to the ground. Perfect. Okay, come on up. Face me this way. Let me check more. Tender.
Just a little bit.
All right, let me give this guy a little. There you go. Let it go. Let me do all the work. Good. We're going to come around one more time. Good. That was a little crunchy.
Yeah.
Good. There you go. Check the elbows. Now let it just fall. Perfect. Now I want you to hold pinky thumb. Good. Relax there. So we're just going to reinforce that wrist. Got that? Check this elbow. Okay. Good.
That's a good one.
Pinky thumb. It's painful, but hold here. Okay, you've got a little bit of a tight muscle right there. We're going to release that really quickly. Pinky thumb. Hold here. Perfect. Relax there. We'll reinforce this. Okay, you ready?
Oh yeah.
All right. So you have a seat here. Head's going to come up there. Perfect. Actually, you're in a good spot. Knee piece is going to come up. So the whole idea of this, that knee comes up. That's going to help to flatten out her spine and relax those low back muscles. I'm going to come up a little bit higher. Perfect. All right. The worst part of this is these pins. Okay, before I put the other one in, here's the instructions, okay? When I wrap the towel around, it'll be snug.
Okay.
You're a bit of breathing, but I want you this whole time, keep your teeth touching, don't bite, just keep them touching and breathe through your nose and just try to relax everything, okay?
Make your belly into jelly.
Yeah. Yes. Now don't help me
Oh,
there.
okay.
If you try to help, it kind of torques your spine. So I want you to just stay there. Is that okay?
It's a good pinch.
Okay.
You weren't lying.
No, I wasn't. That was the when I had it. It was holy cow. You see the video when I'm in there. I actually say that. All right. I want you
I think
Perfect.
I'm just more excited because of the car accident that I've been kind of seeing you for the last year and a half. Because like when I hit the steering wheel, I was twisted.
Right.
So even getting the Y strap adjustment and you pulling, like I feel like this is just gonna straighten everything out.
Yeah, it's a really good pull with the Y strap. It is different because you'll still slide up the table, and even when I've done that Y-axis traction without the pins, without the towel, it opens up well, but you still slide. So this whole thing is going to keep you there
Yeah.
and really get an open spot. So as we do it, just breathe through your nose. All right. Take a good. Give me another one. Take a deep breath in and all the way out.
Oh yeah.
Good. All right.
Yay. Oh my gosh. I'm gonna cry. I told you I was gonna cry.
Now, how far did you feel that down?
All the way down.
You got all the way down? Okay.
Yeah.
I'm going to give you some breathing room here.
Oh, that's amazing. Wow. It's like how they say it just literally opens
Right.
everything. Oh my gosh.
Yeah, yesterday we did someone, and as he walked on, he's like, everything feels warmer, and that
Yeah.
blood flow starts going. Okay, we're going to just check the neck. Good. Chin up a little bit. Good. And wonderful.
Amazing.
All right, we're going to come up. We're not finished yet. And I want you to come on up. Come up sideways. Spin sideways. Come here. You're going to face this way.
Okay.
Okay.
Wow.
Perfect.
Wow.
Doing all right?
It's amazing.
Okay. Now I want you to tuck your chin towards your chest. I'm going to put a little bit of pressure here. It's going to help relax the paraspinal muscles as we sit. Good. Perfect. Now, here's going to be some homework for you, okay? So I want you to bring your shoulders up and back and flare the arms. You feel that squeeze right there? So that's the key to tighten those muscles up. Now I'm gonna help you. I'm gonna exaggerate. Let me do it. You're gonna come back and now look up. Perfect. Okay. This is just putting input into the brain. We're exaggerating better posture. Okay, now relax there. Now I want you to walk around, walk over towards the door,
Okay.
and then come back. How's everything feeling?
It's crazy because when I'm doing my squats, I feel like like you're saying, my back hip is always, or this hip's always back. But now I feel like they're like even. Because normally when I'm doing it, I have to like
You have to
mentally.
kind of compensate.
Yeah, but I don't.
Okay.
I feel like everything's just perfect.
Okay, let's go over to the mirror. I want to make sure that we got everything aligned. Okay, right there. Close your eyes, kind of shake everything out, and go to center. Okay, perfect. All right, so we're evened out on your shoulders. Your hips are down. You can open your eyes, just don't move. Perfect. There, and you're about an inch now or so. What was she, about an inch and a half, I think? You're about an inch there. Now, here's the key. Couple things. one, after we adjust you, here's one of the things to not have to see me as often. Right now you're in a lot better posture, your body's primed, if you will. If you, as we walk, we put a lot of input into the brain. So if you walk heel to toe, a good walk, a good stride, and swing your arms with good posture, you're gonna help to train the brain that this is what we need, especially with your job. The other thing I want you to do is that thing we just did when I had you do that weird posture.
Yeah.
So the whole idea is to shoulders up and back and squeeze, and then I want you to take your chin and come back and then extend, and that's one. I want you to do 45 of those a day. So it's like this, back, boom, that. That's one. Now, good.
Oh wait, so I didn't do my chin.
That's the tough part. Take up,
Okay.
up and back, and flare. Now chin back. Like there you go. Now look up. There's one.
Okay.
Okay. Do it again.
Yes.
Up. Okay. And chin back and there. It takes some practice. But what I want you to do is do a set of 15 and do it 3 times a day. That's going to help to bring that back and start to undo what's happening while you're at work, while you're looking down, those types of things. Okay. Any questions?
No.
All right.
I'm excited.
This is your Utah chiropractor, Dr. Sunny Tuff, with Coeur d'Alene, receiving her first ring dinger. Look forward to seeing you soon.